Hi, Dr. Stroman. How are you? So glad to have
I'm
you
so,
back.
so tired.
Good,
Good
good.
to see you.
Yeah, good to see you too. So glad that you were able. I know you've been super busy, with residency, but I really appreciate you taking out
Yes.
this time to share your knowledge with the community. This is mental health is very important, and we're realizing that more so now, given the times that we're living in, and people need to take action for their mental health. So,
Yeah.
I know the last time we talked, we went over a couple things. So I wanted to pick up about the top three mental health conditions, and we discussed depression, but also I discovered in research that PTSD and anxiety are also among the top three mental health conditions that people experience. So if you don't mind touching
Absolutely.
on either one of those, you can start whatever you want. Yeah.
Yeah. So, anxiety, there's all types of anxiety disorders. There's like subsets of anxiety disorders. But I think most people, when they think of anxiety, they might think of generalized anxiety disorder, where you worry about many different things, not anything in particular, but you worry about your finances, you worry about your relationships, you worry about work, and it's consuming your life. It's it has to go on for about most of the week, right? For about 6 months for it to be like a generalized anxiety disorder. Um, Also, you have like restlessness, edginess, not being able to sit down, like you pacing a lot, you just physically agitated a lot, or irritable. That can be another symptom of anxiety. Um, Also, lack of concentration, lack of sleep. Sometimes people can't sleep because, when they go to lay down at night, they have like racing thoughts, and that keeps them up. You can also have like muscle tension. I don't know if you ever notice when you get really tense, you start clenching your body or I know when I'm anxious, my shoulders can go all the way up here before I know it. I'm like, okay, you can relax. So
Yeah.
you have like,
Yep.
and then that could start like back issues, chronic back issues and things like that. So muscle tension is also like another symptom. Um, yeah, those are the main things, like excessive worrying, restlessness, edginess, irritability,
Yeah.
attention problems, concentration issues, and then like sleeplessness.
Hmm. Yeah.
Um,
Yeah. Look, a lot of people are probably underdiagnosed. They don't even know. Like you may have some anxiety, and that's why it is among the one of those top three conditions that people experience.
yeah,
Um,
yeah,
yeah.
absolutely. And thoughts and things like that can feed into your anxiety. Like, I don't know if you ever heard of cognitive distortions, but that's one thing that you work out in therapy, like
Okay.
like for example, one cognitive distortion could be catastrophizing. So um you may have like little blurry your eyes make it blurry or something for a second, and then now you're thinking, oh, do I have brain cancer and things like that. So like in particular, that would be like if you're thinking about like, do I have brain cancer because of this like blurry vision?
Hmm.
That's more of like a somatic symptom disorder, because
Hmm.
you're focusing on things that you actually can experience in your body, but you're thinking it's like something way
Something
bigger.
serious.
Yeah,
Yeah.
and it can kind of consume your time. You're looking it up on Google and things like that. Um, and you're going to the doctor multiple times, even though they said that, there's nothing wrong with you. Some people, that becomes a disorder, right?
Yeah.
Because it's like becoming disruptive to your life.
Hmm.
So for instance, that's a subset of an anxiety disorder.
Okay.
Um, or like illness anxiety disorder, where you don't have any symptoms, but you might have read about like you might have read online about somebody who had cancer and had particular symptoms or whatever you had a long time ago or whatever, and then now you're
Hmm.
worried like, do I have this, or or
Right.
will I eventually get it? That's like an illness anxiety disorder. There's so many different, like I said, subsets of anxiety disorder, but like a lot of times if we are, if we have like cognitive distortions like catastrophizing, like I said earlier, or um um what's another one? Uh, uh gosh, I can't even think of any right now.
Yeah, I was just gonna
Is
say,
that something that you
yeah, like what what would you call like people that may think something bad is gonna happen? Like they're always thinking like I'm not gonna say or I'm not gonna say anything because I think something bad is gonna happen. Will that will that fall into that category, of anxiety or a certain type of anxiety?
and this is good. Because I was looking stuff up on this earlier. I know that culturally, some groups may have this belief that if they say what they fear, that it can actually happen. If it,
Mhm.
like they bring it to fruition, like manifesting and things like that. That's often seen in some religious groups. There's a Bible verse that talks about death and life is in the power of the tongue. So like,
Mhm.
it may not be a disorder. You look at it in that lens, like a cultural lens,
Right, right.
or I would say like if it's a if it's starting to invade like your day-to-day function and things like that, that's when it starts to become an issue.
Hmm.
Or like the paranoia is like irrational, like there's no evidence of whatever you're afraid is going to happen, like, you know what I mean.
Yeah, that sounds actually more
Y-
like it,
you know
paranoid.
yeah, like
Because
if
like
you
I, I'll just say for me, like sometimes, like if it's look, I can't believe I'm about to say this, but like if it's like
uh
snowing on the road, I'm like, I'm not going on the road because I don't want to be in the car with my baby and then we like crash into the viaduct and then die. Like I
mhm
know that's like extreme, but I'm the fear of sliding in the vehicle while the weather is bad because and with my baby in the car, it freaks
yeah
me out. So I'm like, I'm not going to drive this, today because I don't want. I'm thinking, and that probably more than likely that will not
yeah
happen, but I'm freaking out already, you know.
right
So
yeah. That's
yeah,
just, and that's, it sounds like that's just being precautious, like, um, I would, especially with the baby, you're going to be extremely more careful than with if you're like your own
yeah,
self, you know what I mean?
yeah. Yeah.
But, only when it becomes like so invasive where you missing work, you know what I'm saying? Because you so fearful of leaving the house and things like that. Now you're becoming impaired, you know what I mean? Like your money is being tampered with now because you can't work, and like, you know what I'm saying? So it's
Mhm.
it's more invasive. The
Okay,
disorder's more invasive, yeah.
okay, cool. Now, PTSD, which is another one among the top three, depression, anxiety, PTSD, which we know, post-traumatic stress disorder occurs because so people have incurred something traumatic in their life
Hmm.
and it's
Yeah.
post effects of them mentally. Anything specifically that you know or would like to share about the symptoms? We don't have to get into the details, I guess, about what can cause. We know there's so many different things, and I feel like traumatic experiences, it varies per person because this person may think that seeing certain things isn't traumatic opposed to someone else, it would be
Yeah.
traumatic to them. Um,
Right.
so I don't know for me, like I'll say, when I lost my mom, like I literally do replay what happened when she got into the hospital, when I got the phone call, like, from the hospital and just seeing her in the hospital, everything that happened, it constantly does replay in my head. So I was like, am I developing? Do I have PTSD? Like, from that experience. So
Mm-hmm.
you can even use my example if you want to
Yeah.
touch on PTSD.
Okay. Yeah. Thank you for sharing that. And once again, I'm sorry to hear about your mom.
Thank
Moms
you.
are very special.
Yes, they are.
Um, yeah.
Yeah.
So I would say, like, I could just talk about some screening symptoms, like when I see somebody in the ED, um, you know, in the emergency room,
Mhm.
I'm looking for, okay, have they been exposed to something traumatic?
Mhm.
And then we may ask, like, what was the nature of it? Was it physical? Was it emotional? Was it sexual? But we don't get into details right then and there.
Right. Right.
Um, so, and then I would ask about, are you having recurrent nightmares, PTSD related recurrent nightmares about, like, often, is it waking you up at night? Are you getting up like fighting or swinging?
Right.
Depending on what
Yeah.
the trauma was.
Mhm.
A lot of, so me being a resident, I work at the VA, so we see a lot of like veterans and things like that
Yeah.
who could have been exposed to combat.
Mhm.
So they may get up physically fighting or whatever. Um, and hypervigilance, like when they go out, they're looking around. I know some veterans say they always make sure that they can see the door in case they got to escape. You
Mhm.
know, if there's a all of a sudden a loud explosion, they get startled easily, things like that. I mean, well, anybody can get startled easily from a loud explosion, but like, say for
Yeah.
instance, a door closes, and then whereas when you're in a restaurant, you hear that, you kind of just keep going in your conversation. But somebody who's a little bit more aware of their
Mhm.
surroundings and have PTSD, they might like jump, and they might like think, oh my goodness, are we being invaded upon or something,
Right. Yeah.
um
Whew.
yeah.
Mhm.
What else? So I talked about nightmares. Oh, you flashbacks. um
Mhm.
and this can happen anytime, where you just kind of re-experience the situation, like as if it was like fresh, like it's like it's happening right then and there. Some people can feel the sensations, and things like that. So a flashback, excuse me, can occur.
Mhm.
um um Also, irritability as well. Some people describe irritability and numbing out in conversations, kind of not being present in conversations and things. Thinking that a lot of times, with people with PTSD, think that their like situation is so unique that nobody can really understand,
Mhm.
you know. So you kind of just like feel alone. And a lot of anxiety and depression kind of like overlap with PTSD, to
Yeah.
be honest. If those symptoms go unmanaged, especially if you can imagine, like if you can't sleep, you start getting depressed or anxious and things like that. So yeah, it all overlaps.
Yeah. Yeah. And I can see that. I can see that because obviously, if something traumatic happened, that can cause you to be depressed. That can cause, anxiety.
Yep.
So they all, yeah,
Yep.
they all mixed together. Makes sense. Makes.
Exactly. And if you can imagine, also, I forgot, one of the other screening symptoms is avoiding places that remind you of
Hmm.
that trauma. You
Yeah.
know, so like you said, use an example like with your mom. Is that your daughter? You
You
got me
hear her?
cutting your
You
eyes.
can hear her. Let me see what she want. Pause my microphone.
That's okay.
I know
No,
I should have brought me some. Um,
it wasn't bothering you. It was just so funny because your eyes looked over there. It's like you seem.
I, yeah,
No.
right. I got the door closed. She tells us she wants some sausages. She already had some little sausages with her pancakes. She loves them. Oh my gosh. I know. I'm always on. Unfortunately, mommy duty doesn't end.
Yeah, of
But
course.
yeah, yeah,
Yeah.
yep. So, but yeah,
Yeah, I was
yeah,
just saying,
totally.
like, one of the last ones that I had missed was avoiding. So like avoiding places that remind you of that trauma.
Hmm.
Um, Basically, yeah.
Yeah.
Yeah. And then that can, lead to isolation. And that's one of the many complaints a lot of veterans come in, saying that, I feel isolated, like they just lost a significant relationship, and then that's when the depressive symptoms start coming on. So
hmm hmm
yeah.
Yeah. And so for me, I remember was it was last year because she passed in August of last year,
Mm-hmm.
and um, I drove in the it's I don't know if you're familiar with the Livonia area. It's a Middle Belt area where the shopping centers is. Like she used to go over there all the time, and I don't know what I was driving over there in that area to go somewhere, and I just got overwhelmed with emotion, and I'm like, I don't even want to be in this area because it reminds me, because I know we used to come over here and go shopping. We used to nail salon we used to go to together, over there, and you know,
Yeah.
um, so yeah, yeah, that
Mm-hmm.
that yeah.
Okay. Yep.
Um,
And that's and
so
that's that's just a part of the grieving process too, because grieving, unfortunately, it doesn't just like it's like a period of time and then it ends. It's kind of like it comes in waves. You know what I mean? Comes
yeah,
unexpectedly.
ebbs and
Like
flows.
yeah, it ebbs and
Yeah.
flows. Yeah, for
Mm-hmm.
sure.
Yep. And I got an understanding of that, like it will never be a time where I'm like, oh, I'm just fine. Like it's always, you get better. What I've learned, you get better with coping with the grief, but it doesn't just go away,
Mm-hmm.
So yeah. Um,
Absolutely.
yep. So
Mm-hmm.
with that, I also wanted to get into this topic that I don't feel is touched as much when we talk about mental health, because we talk about the most common types of mental health
Yeah.
conditions: depression, anxiety,
Mm-hmm.
PTSD. But there's also other mental health conditions that actually falls into the category of serious mental illness. Um, so I came across in my research, and I'm referring to my notes here, that Black
Mm-hmm.
Americans are more likely to experience outcomes related to schizophrenia, including hospitalization, homelessness, incarceration, and employment. Um, uh, uh, yeah. So what I want to talk about, I guess we can start with schizophrenia, because I think that one is, correct me if I'm wrong, Doc,
Mm-hmm.
is highly diagnosed among African American people.
That'd be correct.
Okay.
Yeah.
Yeah.
Yeah. They're likely 3 to 5 times more likely to be diagnosed with schizophrenia than like, our white counterparts. And Latinos are 3 times more likely to be diagnosed with schizophrenia compared to our white counterparts.
Okay.
Um, and that's often like a misdiagnosis. There's several reasons to that. One of them, and I'm also looking at my notes too.
Yeah, you good.
um, yeah, one of them is that, you know, say for instance, bipolar disorder. I don't know if we talked about mania in the prior video,
I
but
don't think so.
that's if you when you have one manic episode, that puts you into the category of a bipolar one disorder.
Oh, okay.
Um, there's two types. So it's bipolar one and there's bipolar two.
hmm
It's controversial to say that bipolar one is more severe than bipolar two because depression and bipolar two can be very debilitating. But they're both equally debilitating. But like bipolar two, the mania is just not as as heavy. You may not be hospitalized for it, a
Right.
hypomanic episode.
hmm
But on the other hand, schizophrenia is overdiagnosed in Black people, but major depressive disorder, bipolar disorder is underdiagnosed. And one of the reasons is like, you know, if, if you have undiagnosed bipolar disorder and then you have a manic episode and it gets worse and it's not treated with a
hmm
mood stabilizer and an antipsychotic, you ended up eventually having psychotic symptoms. It gets so severe so you have psychotic symptoms. And so that's when, I'll see them in the hospital where the police brings them in because they're trying to stop traffic because they think that they have the authority to do that. They may think that, I'm true law enforcement and some, and then to us that's psychotic. Like, it's a delusion, it's a strong delusion.
And that's during
um
bipolar too, you're saying, before, if they're not being treated.
yeah, bipolar. Well, if you have to be hospitalized, more likely you have a manic episode, and that
Mhm.
would put you in the category of having bipolar disorder. But a lot of times, African Americans, if they're not coming in to be seen, because of lack of education or what have you, lack of access to care, poor, no insurance, no coverage, things like that, they'll come into the hospital because of the police bringing them in. And
Mhm.
then all we see are psychotic symptoms. Um, but we may not. And typically, if you see somebody with psychotic symptoms, you give like an antipsychotic, but that's not really enough to treat bipolar disorder. So then they're not being treated,
Properly, yeah.
properly.
Hmm.
Yeah. So it's important to get the diagnosis correct so then you
Right.
can, that guides your treatment and things like
Hmm.
that. And then also, African Americans tend to not follow up to, come back for follow up, outpatient. And so a lot of times we need to see that patient longitudinally to be able to give a correct diagnosis.
Right. Hmm.
So there's many different factors, the reason why that can occur.
Yeah.
Yeah.
Yeah. I was just thinking, I don't know if you're able to answer this question, but have you came across anything in research or, while you've been in school as to why schizophrenia is diagnosed among African Americans so much, like in Hispanics? Like what could, is there any research that you
Mhm.
can speak on that's talking about that?
Let's see. Um, Specifically schizophrenia. It could be also like bias from the clinicians too. Say for instance, I didn't experience this, but there was a attending in my program who did experience this, where a lady came in uh speaking gibberish. They thought she was speaking gibberish. She wasn't making any sense. And one of the criteria for diagnosing schizophrenia is like disorganized speech behaviors, things like that, like
Hmm.
delusions, hallucinations, um and disorganized speech. Like if I can't follow what you're saying,
Hmm.
and you're saying is sometimes they could say bizarre things, then
Hmm.
that's psychosis. And that so this lady came in, with her church members, speaking gibberish. And what they didn't know was that culturally, right,
Hmm.
and especially in African American, well, no, there's also, there's many people who are Pentecostal no matter what um
Grace, yeah.
uh race you are, and they believe in speaking in tongues.
Hmm. Hmm.
So,
Hmm.
in the text, in like an academic text, it's called I think it's goodness, glossolalia or something, glossophilia,
Hmm.
I can't recall, but um, so basically, they, I want to say they thought she might have been psychotic.
Okay.
You see what I mean? But she was
Yeah.
not. I think that's,
Right.
it's kind of like almost being in a trance. Some people believe it's almost kind of like being overtaken by the Holy Spirit, right? When you start speaking in
Hmm.
tongues.
Hmm.
And so, however, so apparently they did give her some Haldol, which is an antipsychotic. It was like a first generation antipsychotic. And eventually, she broke out of it.
Okay.
I can't really say the what developed after that, like what that clinical course was like in the ED, but I mean, eventually, um yeah, she snapped out of it.
Right. And
So,
and you said
but you wouldn't want to label somebody like that with psychosis or schizophrenia, because that wouldn't be accurate. Like that was just like only
Mhm.
one snapshot of her life. You
Mhm.
become a little bit more suspicious too if she's older and started to get this diagnosis, because schizophrenia really comes in way earlier, like late adolescence, early
Okay.
20s.
Yeah.
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 Mm-hmm.
Well, yeah.
Yep.
So I can see, yeah, how that and many other right misdiagnosing of people can happen. And
Mm-hmm. Yes. Yeah. Just not being culturally competent or aware of how people,
hmm
of how people present and things
yes,
like that.
yep. Which I know in in medicine, cultural competency definitely needs to elevate. And I guess they're trying to get better, but I don't know. We'll see. But there's definitely a lot
Mm-hmm.
to learn about different cultures. And it would definitely help, how the provider can better care for the patient and understand certain things and behaviors,
Yeah,
beliefs, things, for the patient. So,
for
um,
sure.
but yeah,
Yeah.
yeah, I I kind of want to piggyback on bipolar because that is another one that I feel like that's a popular diagnosis too,
Mm-hmm.
for a lot of people, and I've read up on it a little bit because I used to work in a group home for almost 3 years with we refer to them as consumers,
Yep.
but they had we had bipolar, we had dissociative identity disorder, we had schizophrenia, anxiety, uh, what was one, I can't remember what her diagnosis was, but she pled guilty by not guilty by reason of insanity because one of the class she barricaded herself in her home and she tried to attack the police with a knife, but I forgot what her diagnosis is. But yeah,
Okay.
but either way, I learned some stuff when I was working in a group home. That's been over 10 years. 10 years?
Mm.
What's this one? Yeah, yeah, over
Time
10 years ago.
flies.
Um, it does, girl. I'm like, I'm getting closer to 40 and this is not, no. But anyway, so, so, yeah, but I would like to learn more about it. I do have some family in that's diagnosed with bipolar. I think it's bipolar too, though, because we haven't had anybody go into no manic episode. I will say my family, this is on my mother's side, they can get a little crazy. Um,
Okay.
and I don't think they're medicated. Like my aunt, I don't think she on medication. But
Mm.
anyway, um,
Mm-hmm. Okay.
yeah. So with that being said, is because I didn't research that one. I don't know. Something pulled me to schizophrenia, but
Mm-hmm.
is that one? Would you say that one is highly seen among African American people, or is it kind of you know levels out throughout races and ethnicity?
Bipolar disorder?
Mm-hmm.
Yeah. I mean, I I did see in my research that it's like the same rates amongst all races, like
Yeah.
it just so happens that bipolar disorder is actually underdiagnosed in African Americans though.
Mm-hmm.
Because of like barriers to seeking treatment and things like that.
And
Whether
like
it's just
the
mistrust,
education, like you said.
yeah, and
Mm-hmm.
mistrust in the system. Also, a lot of times things can go missed, including depression, bipolar disorder, because of lack of research of African Americans. A lot of African Americans are left out in mental health research.
Mm-hmm.
There's a difference in how people present their symptoms,
Mm-hmm.
but it's still the same,
Yeah.
so I can say, for instance, I don't know about bipolar, but for depression, Black people tend to complain about aches and pains,
Mm-hmm.
what we call somatic symptoms, body sensations,
Mm-hmm.
whether it's fatigue or pain, or low libido, things like that,
Mm-hmm.
desire for sex and stuff like that. So we may not complain about emotional distress or emotional dysregulation, like sadness. We may not present
Mhm.
like that. It's more somatic,
Yeah.
but that's right, and it can just slip under the radar. So I think now what I've been seeing more when I even go to the doctors, they do like screenings and things like that.
Hmm.
Like whether it's the PHQ-9, which looks at like some, depressive symptoms, and then they have like
Yep.
anxiety. I think they do have the anxiety screens now too, when you go
Okay.
to the doctor's office for
Hmm.
everybody.
Yeah.
Um, but yeah.
Yeah. Yeah. That's that. Yeah. I remember when I did my prenatal, postnatal appointment, I did the PHQ, and I think yeah, when I did my physical, they asked me it was those the depression screening questions too. So,
Yep.
yeah, that's very important because, like you said, it's this the somatic symptoms is everybody presents differently. So just because they're
Yeah.
not presenting with sadness, that doesn't mean they're not depressed. That doesn't
Hmm.
mean, they don't have something mental going on. And like we had mentioned in the previous video, that physical, mental health work in harmony with each other. So,
Yeah.
when you are experiencing certain things, whether it's related to depression or anxiety, it will trickle into your physical,
Oh
you know,
yeah.
body. Yeah.
Uh-huh.
Uh, and people may not realize that. But a good thing is that
Yeah.
the healthcare system is getting more more vigilant, I should say, or proactive about identifying if though that could be a possibility. So,
Yes.
um,
Absolutely.
but going back to the bipolar disorder being underdiagnosed in African Americans, I definitely think so for sure because I think I had seen something on social media. It was talking about
Yeah.
like you got that crazy uncle. You talk about that crazy Uncle Pete, and yeah, no, something is really wrong with Uncle Pete.
Yeah.
Like he ain't going to the doctor get diagnosed.
Uh-huh.
But yes, something is wrong with him.
Yeah.
And unfortunately, given lack of education, obviously the stigma about mental illness among African Americans and other cultures, and then the trust in the healthcare system, because it's so many barriers
Mhm.
to that. So that lack of trust, and then the fear of being experimented on, and all this kind of stuff. So that's why I feel like it's very important, for racial diversity in the medical workforce,
Yeah.
like because it helps people, referred to as racial concordance.
Mhm.
It helps people to build that trust, to communicate better, like to be more honest. And there's proven studies that shows that people that are racially concordant with their providers,
Mhm.
they, the communication is better, they're more honest, they're more adherent and compliant.
Yep.
Um, so it's
You're
very
all in my
important.
notes. You're all in my notes. But I love it.
Yeah, right. Because we're here. We're here. We're here.
Right.
Um,
Yes.
yep. So yeah, it that's I think for mental illness, mental health, it has to improve. It's gotten worse. I read, I think it's the Mental Health America Association, that the United States, I feel like the world, we're in a mental health crisis,
Mhm.
and there has to be better ways of going about it. But the first thing is that people need to acknowledge that they have something going on, and then they have to seek help.
Yeah.
And then, like you said, we need you to continue that help. You can't just go in and then, you know what I'm saying,
Yeah.
and just no return. It's very important to do your follow appointments. Go ahead.
Yes. It's
You
like
it's look like you got a
it's
thought.
yeah, I mean, because all of these disorders that we mentioned are chronic. So it's least likely going to have just one depressive episode. We will hope you don't, just have one,
Hmm.
but there's a chance you're going to have another one down the line, Um even with schizophrenia, it's a chance that you'll have another psychotic break. So you have to be followed up on. You have to stay on your medications.
Hmm.
Don't get off your medications without consulting with your doctor. Okay. I mean, there are some cases where you can lessen the medication
Mm-hmm.
over time and things like that. Um, but like I said, you have to do that hand in hand with your physician. But yeah, I think it's a disservice to, Black people when we don't follow up because, depression is more severe in African Americans, like as far as like the chronicity, how long the episode lasts because it's not being treated and you're basically suffering.
Mm-hmm.
Whereas somebody who have embraced the fact that they struggle with depression, they'll go in and they'll get the treatment, but you're not progressing because of fear of, and this is a legit concern. You African American and have a mental disorder, and that's kind of like a double negative against you. You know what I mean? And so I think a lot of people look at it that way. um However, no one will know of your treatment unless you tell them. You know what I mean? There was a patient that I saw who came in, who was suicidal, and it was a Black man, and he was going through a lot. Like, I think it was financial things, and relational issue. I don't know if did he have relational issues? I don't know what it was, but he said that he stopped his medications and things like that because of fear of what other people may think about him. And he also felt like once it's like in your chart that you have a particular mental health diagnosis, then you feel like he felt like he was going to be treated differently. Like
Mm-hmm.
other people wouldn't believe him and things like
Yeah.
that. And so, and that's unfortunately, like, that's a legit concern because that can
It is.
actually happen.
Mm-hmm.
That can actually happen. Racism is dangerous.
Mm-hmm.
And so these are the things that African Americans are up against, but unfortunately, because we don't get the treatment, we stay sick longer. We're more likely to be hospitalized for our depression, because depression it can be managed outpatient. You don't have to come into the hospital and
Right.
lose work hours and lose out on money, so.
Mm-hmm. Mm-hmm.
Mhm.
Yeah.
So
And unfortunately, I feel like that's in many chronic conditions, even with, uh, health conditions regarding the body, heart disease, diabetes, like a lot of that stuff is diagnosed late when it's, gotten too far. And,
yeah,
so yeah. But
absolutely.
I, I again, just going back to the idea of the mistrust in the healthcare system, and then just not having that diversity, like African Americans and Latino, like, are underrepresented in
Yeah.
the profession of medicine.
Hmm.
And even just the studies, like you talked about, a lot of African American people are not included in these studies. So that's a gap right there too.
Hmm.
Then it's like, how do we get more people to participate? Because culturally, the whole idea of being a guinea pig is wrong, but not wrong, but it's a wrong
Yeah.
idea. I understand why people feel the way they feel. Um,
Yeah.
but it's like, how can we, as a society, as a community, how can we help build that trust? Because it boils down to trust. Like, that foundation,
Hmm.
trust has to be there.
Uh-huh.
How do I know that what you're doing is in my best interest and the best interest of others? And I think that's another way to kind of see it too. It's like, it's not just like what you're doing is going to help thousands and thousands of people.
Yeah.
Um, and how providers can better care for people that look like you.
Yeah.
So
For sure.
yeah, I mean, we got a long way to go, but
Yeah. Yeah. I think one way, I mean, that's a loaded question, but it probably was a rhetorical question too. But like, I just wanted to add that one way we can probably help with getting people to, I guess, trust the healthcare system is like meeting people where they are. Like I'm a part of CMHI, it's the Christian Mental Health Initiative. And
Mm-hmm.
so basically we go into churches, and there's like training sessions.
Okay.
And you can go into your local church, or to like disseminate information about like what I'm telling you right now, because a lot of African Americans, we rely on our spirituality, whether that's going to the Kingdom Hall, whether that's going to church, whether it's going to the mosque, things like that. We rely a lot on our spirituality for hard times. And so,
Mm-hmm.
but we still have to know the difference between when we're in a mental health crisis, um, versus we're just stressed out,
Mm-hmm.
knowing what's the difference between normal and abnormal. So that, I think that's one solution is, us mental health professionals and things like that going into our communities and educating in the barbershops. I was a part of a study. This was different. This was aside from mental health, it was, I think, HIV
Okay.
education. We went to
Yeah.
a barbershop and we just talked to people about different, you know prophylactic treatment for HIV,
Mm-hmm.
that's available to people, and things like that. So
Yeah.
I
Nice.
think that's one. And also, I have a friend who, she's a adult child and adolescent psychiatrist, and she has um a group for students of color, who are interested in mental health, whether it's psychology, to be a psychologist, to be a psychiatrist, to be a counselor, all different levels of mental health. So like she have meetings every month, and that's just to increase the interest, to tell people how incredible our field is and things like that. So
Yeah.
pipeline programs, that's what essentially it is. I
Good.
think we need more of that to increase like racial concordance, um in the field of medicine.
Absolutely,
Yeah.
absolutely. That's 100%.
Yeah.
And I had read, because I did a live video on racial concordance, and I did some research, and I went over that research during that live. But one of the articles that I came across, it was this doctor that talked about, how for one, how African Americans were discouraged and pretty much barred from uh invest their education in medicine back in the day.
uh,
So that's why the percentage of doctors that's African American is low in the first place, because they weren't allowed the opportunity due to racism. But
yeah.
he was, the doctor was saying that we need to pretty much mentor from we need to start from kindergarten, like from kindergarten on up to high school. Like we want to mentor children to have an interest, to build an interest, like your friend is doing in mental health care.
Hmm.
Let's we don't have to talk about nothing against being a rapper or a basketball player, but that's not the only thing
Yeah.
that we can do. Like we
Hmm.
need more people, we need children becoming interested in medicine. So
Yes.
we start from young to influence them or whatever. So he said
Yeah.
that, and programs like your friend is doing in the community, stuff like that, is very important. And even like what you were a part of, the barbershop thing, going to barbershop. And that's actually something that I want to do, because I've started my health education consultancy, and that's one of the things that I want to be able to do is to
Awesome.
talk about preventive health. Thank you. Yes,
Yeah.
to go out in the community, and I want people to pay for this. Like I just want to be able to give back from what I know, and to help build that trust. Like you said, that's a start.
Hmm.
Build that
Hmm.
trust. Let people, see that there be a reflection of those that in the community, and let that come from me, um, being a leader in healthcare and having experience in healthcare,
Yeah.
to say this is what you do, and I must tell you what to do and how to do it. And if you need help, I'm here to help you. I'm here to advocate. I'm here to guide
Hmm.
you. Because it's so important. It is, and I feel
Yeah.
like if there's more of that happens, then maybe we can get more people to be more compliant or reflect on that conversation or that presentation, whatever that was said, something that triggered them. It's like, you know what,
Mm-hmm.
Dr. Stroman, she did say that if I don't do this, that my life could, like
Yeah.
I remember what Dr. Stroman said. I remember what Latanya said when she, so
Uh-huh.
sometimes we want to influence, we want to be able to influence the community in a good
Mm-hmm.
way.
Mm-hmm.
And if more of that happens, I think that would help. We can't
Yeah.
save the world, obviously, but we
Right.
can save some. We can save some. So whatever we can do to save some, I think it's important.
Mm-hmm. Absolutely. And if and correct me if I'm wrong, did I hear you say something like if we um open up like with our own experiences and say like this is what I did that worked for me. Did you say that earlier? And that like, to build trust like and patience.
Well, yeah, and I think
Is
I
that
was
personal?
saying, I think when I was referring to that, when I was talking about the my experience with, I would say feel free to use my experience as an example if you don't want to get into. I think he was talking about the PTSD when I was talking
Oh,
about,
okay.
yeah,
Yes.
yeah,
Okay.
hmm but yeah,
Okay.
yeah, that too, like you said, yep,
Yeah.
sharing
Because
our own experiences.
right. Because I was thinking, I was like, I feel like, and I think it depends on the provider, like, open disclosure, self-disclosure rather.
Yeah.
So my therapist, she didn't mind sharing things about her personal life.
Hmm.
But I think overall in with the profession of medicine is kind of like discouraged, because I guess
Hmm.
it could take time away from focusing on that patient. But I think I also learned in my program, you got to read the room. You know what I
Hmm.
mean? Sometimes, like in the like early part of the relationship, it may not be appropriate,
Yeah.
but once you build rapport with the patient and things like that, it's okay to have like open disclosure and things like that. What have maybe worked for you or somebody in your family members, especially if you have racial concordance, right? And so
Hmm.
they can see themselves in you. And I
Hmm.
think, one thing I did learn about marketing a long time ago in undergrad was about, the best um way of marketing is about word of mouth.
Yeah.
So if somebody tells you like I've tried this and it worked, you're more likely to buy that product than
Hmm.
if you saw in it like
A
like
commercial.
a commercial or something like that, because somebody you knew said that they tried it and it worked for them. Somebody
Hmm.
you knew and trusted,
Hmm.
So that's a good idea.
Yep. Yep. That's unfortunate that it's discouraged, but I think it's effective.
Hmm.
I know it will be effective. Yeah.
Yeah.
So it helps, like you said, to see yourself in that person. And then,
Hmm.
healthcare professional, for the most part, the patient looks up to them as a superior
Hmm.
authority, So they but have trust that you know what you're talking about, and then to hear like, oh, you're human,
Hmm.
you're like me,
Yeah.
that, yes,
Yeah.
that will seal that gap of hesitancy or whatnot. So
Right. And
yeah.
there's some, non-clinical things that we learn, excuse me, in medicine, because anybody, put aside racial concordance, you don't have to be black to understand black people. You know what I
That's
mean? As long
true.
as you have compassion, as long as you, are willing to learn and have like what you call that
Hmm.
cultural humility and things like that.
Yes.
Um, hey.
Yes. Cultural
But
humility.
yeah, yeah, exactly. So I mean, one thing I learned was when you walk into a patient's room, there's a study that happened where they said where it showed providers who sit down with the patient perceives that they spent more time with them, even though in comparison, um
Mm.
like to someone who stood up the whole time, in comparison that they probably had the same amount of time with the patient, but the person who sat down in that interaction, it looks like they spent more time with the patient because
Right.
they sat down,
Yeah.
asking what other questions do you have. That builds trust as well.
Hmm.
Instead of like hovering over the patient, it kind of looks like, you're the authority figure and they're the submissive, consumer.
Yeah.
The submissive consumer or whatever. Like, I'll do whatever you tell me to do, doctor. Like
Hmm.
it's not supposed to be a paternalistic type of relationship. You know what I mean?
Right.
So, but that
Yep.
can symbolize that if you're like hovering over the patient and, instead of like sitting level with the patient, seeing eye to eye, you know,
Hmm.
um, it's the little things that can like build trust,
Yes.
you know.
Yep. Absolutely. Just the little things.
Hmm.
Just sit eye level. And I mean, that's something that you learn. I, I was in nursing school, long story, but just
Okay.
certain things you just, if you work in healthcare, you learn, sitting at eye level with the patient, it helps you connect with the patient better. I don't know
Yes.
why some doctors feel like they need to be standing up over people anyway. Like, you need to sit down
Yeah.
and listen to your patient and don't be finishing my sentences. Like, I had a doctor's appointment with an orthopedic doctor, and I'm just like, he's finishing my sentence. I'm like, you're not listening to me.
Big no no. I've been there
Yeah.
too
So
personally.
yeah.
Yeah. And they
Yeah.
gave me and they essentially I think gave me the wrong treatment
Mhm.
because they wasn't listening.
Mhm.
Yeah. Big no no.
Yeah. Well, Dr. Stroman, this has been an absolute pleasure. I wanted to
Yeah.
say, did you have any closing comments or anything before we end this video?
Um Very good.
Okay, cool. All right.
Yeah.
Well, with that said, I really appreciate this time with you.
Mhm.
You are phenomenal. You're going to be such a blessing to your patients,
Thank
and
you.
you're welcome. And just keep doing what you're doing.
Yeah.
Keep yeah, stay in for the fight, and I'm
Yeah.
here. Look, when you're ready, look, we're gonna have to team up and do some
Yeah.
community stuff.
I would love that. To
Yeah.
be and I'm honored, and I thank you for being patient with me because I know it took us a long time to get here.
Yeah, no, it's
And that's
fine.
me being a mess. I know I'm a mess. I need to get my life together in 2025. I'm
You're
working on
fine.
it.
Yeah, you're fine. We all busy and overextended in our
Yeah.
responsibilities, so you're not alone.
Yeah.
Um, I
Okay.
just appreciate that. Look, better what they say, better late than never.
Yeah. Absolutely.
Better, better late than never. So
That's
that's
right.
what we gonna call it.
Yeah.
That's what we gonna call
Absolutely.
this
Thank you so
situation.
much. For inviting me to do this. It's an honor. It's actually part of, one of my goals, is just to be a part of educating the community and things like that. So yeah, really
Yep,
appreciate
same
it.
here. Same.
Mm-hmm.
That's what Healthcare Corner Talk is all about. Educating the
Yeah.
community, building that health literacy among people that, don't have it. So
Right.
people can be more informed about their health care, their choices, and make better decisions.
Yep.
Yeah.
The keyword is empowered.
Yeah. Yes. Empowered.
Empowered.
Yeah.
Yep.
Mhm.
Absolutely.
Yeah. That's my business name. Well, it's E2E, but E2E stands for educating to empower.
Oh, I love that. I
Yeah.
love that.
Yeah. E2E healthcare solutions. I don't know. I don't know if I follow you because I couldn't follow people for some reason. I was trying to follow people when I first started it. I think it
Uh,
was a security thing. They try to probably Instagram want to make sure it wasn't like spam or anything. But
oh,
I'll make sure I follow you on that page.
okay.
But
Okay.
yeah.